Well, we're here with Dr. Zhitnitsky again, dentist from Nuys. Hi, Dr. Zhitnitsky.
Hi, Helmut. How are you?
Good. Dr. Zhitnitsky, let's today talk periodontal disease, gum disease, as it's also called. And let me tell you something, and then you tell me how wrong I am here and how way off I am. You know, when people have periodontal disease and gum disease, dentists keep saying, you really got to fix it because otherwise you're going to lose all your teeth. Now, while losing, and that's the stress they put on, and while losing all your teeth is a very bad thing, and I'm almost sure, or 100% sure, that it will happen, here is what I think. You have an infection in your mouth, kind of that yellow, ugly, reddish pus. Stinky and everything. So never mind that part, but there it is, that pus, an infection. And it is at the gateway of the blood vessels, because that's what the mouth is. It's the gateway. It's you know, the blood vessels are so open there that, you know, that's why you put stuff under the tongue, so when a person is half dead, he right away comes back to life. So here you have that yellow pus going into the blood vessels, dripping into the blood, going to the liver, to the kidney, ruining the liver or the kidney, creating heart disease, creating, strokes, lowering the immune system. Babies are born premature and underweight, and all that stuff. Now, it looks to me that those things I mentioned, if they happen, and I want you to confirm or disconfirm that, of course, if that happens, it looks to me that that is an awful worse than losing your teeth, because at least you dentists do wonderful implants. So if money is not an option, no big deal. Flop a few implants in it, we're fine. But while it has happened, 1, 2, 3, 6 years, whatever that progresses, you're slowly and surely poisoning your body. True or not?
Oh, absolutely true, Helmut. You're also forgetting diabetes, Alzheimer's, and Parkinson's.
Jesus.
The same bacteria causes, and if you connect all the bacteria together on all the little sores that you have in the mouth, the average size of a lesion in gum disease is about the size of the palm of your hand.
Unbelievable.
Now, for example, if you would have a sore that size on your chest or on your leg, you'd treat it, wouldn't you?
You treat it when you have the size of a penny, for more than 2, 3, 6 days, as you should. You would run to a dermatologist, as you should. But here you don't treat it at all. And it stays there for years and years.
The problem with gum disease is that it doesn't hurt. If people would have pain with gum disease, they would seek treatment much sooner, and they would have much fewer complications, and hopefully we could even eradicate it that way. But unfortunately, it doesn't hurt until it's too late.
Right. And again, so would you agree that, while losing the teeth is of course a bad thing, and a person then has to, if for some reason, let's say he keeps up the gum disease because it does cost money, everything to stay healthy, to stay pretty, to have fun, it simply costs money. So if a person is because of money not doing it, as he goes to a dentist, because I've seen and I've talked to many dentists and they tell me that patients literally look at them as like, yeah, right, you just want to make some extra money here. Have you noticed things like that? Kind of, a little bit?
Well, people are definitely concerned about money. But the problem with gum disease is procrastination, not treating it. You will actually have to do more treatment down the road, and it'll cost you even more.
A lot more.
They say prevention is worth a pound of cure.
Right, and so it costs you more to put in the implants, the crowns, the bridges, whatever it is you need. Never mind that in the meantime, you might have irreversible damage, liver, kidney, stomach, diabetes, stroke, all kinds of things. And maybe if you were pregnant throughout that time, you wonder why your baby is so little.
If you have gum disease, your chances of a heart attack or a stroke is about 3 times greater than if you smoke. So smoking is actually better for you than gum disease.
Wow. Yeah, I have heard, tell me whether that's true, that lately, over the last, 2, 3, 4 years, Dr. Zhitnitsky, that more and more, not that it was not there before already, but over the last few years, drastic increase in surgeons, whether they do a hip operation, or a meniscus operation, or take out appendix or the tonsils, that they demand from their patients a clean bill of oral health, because they say, look, if you, and they're especially concerned with gum disease, not so much with a little cavity or with whatever. They're concerned about gum disease. They say, if you have a gum disease, I don't want to operate you because my operation in the knee, in the hip, the appendix might go simply wrong for 2 reasons. It may go wrong because your blood is poisoned and it's going to make my operation, my wound not healing. And on top of it, you are weakened by this disease, so you could have all kinds of other complications, and for a purpose, I could kill you. True? I mean, what is up with that?
Absolutely true. You have a low-grade chronic infection that you don't treat. That means that your immune system is loaded up with bacteria all the time that it's trying to fight.
And what's a low-grade chronic infection? What's the word low-grade have to do with?
Low-grade means that you don't notice it.
I see.
When there's no fever. When you have a severe infection, you got a fever over 103, you run to the doctor. Now, if you have a low-grade infection, there is no fever that you notice.
Right.
But it's still there. It's still doing its work. It's still destroying your body. It's not noticeable to you. And a lot of orthopedic surgeons would do a lot of patients. In fact, I do have a patient right now who's waiting for a lung transplant. And they will not do it until she gets rid of all her infections in the mouth, including infections in the mouth, but this is the major part.
Right. Well, and if you can do things so severe, underborn baby, even stillborn baby in California, and diabetes, and if surgeons stay away from cutting into the body somewhere else because it creates problem, wouldn't that cause daily, like maybe a fatigue? You don't know it comes from there, or wouldn't the next flu season be more dangerous to that person than it otherwise would be?
Oh, of course. If you're healthy, you resist infection much better than if you're not. And if you have gum disease, it's not only that your mouth isn't healthy, the rest of your body isn't. Because that infection circulates throughout your body, and it infects all your organs, and the body has to fight it constantly.
Right.
So it's better not to have it and be absolutely healthy.
Right. Well, absolutely. Well, Dr. Zhitnitsky, thank you very much for shedding so much light on it, for being so candid. And I'm sure patients out there will be lots of patients, people seeing that, who will go and say, I think I better do that gum disease. I mean, and we haven't even mentioned one thing here, which is people with that type of gum disease, they have a smelly mouth, don't they?
Oh, yes. It's one of the major causes of halitosis, which is a medical term for a smelly mouth. And it affects your social life. It affects your self-confidence. Definitely should be taken care of.
And no Listerine is going to take care of it except for a minute or two or whatever, for 5-10 minutes, right?
It's like putting a Band-Aid on a gunshot wound. It works for a minute, but then it's gone.
Got it. Thank you very much.
Thank you.